Hello everybody! Today I'm going to talk about the modern public health issue of Alzheimer's disease. I'm going to explain the disease, its importance for public health, present epidemiological statistics, and showcase any disparities by sex, age, and race. I will also present public health prevention strategies and existing public health programs. So let's get started. So what is Alzheimer's disease? Well, according to the CDC, it is a disease that is a form of dementia that begins with memory loss and could lead to the inability to continue conversating or responding to the immediate environment. It is important to note that scientists do not completely understand Alzheimer's disease, but research is of course expanding. It is evident that Alzheimer's disease does not only control memory, but it is in charge of different parts of the brain that affect thinking, behavior, language, and activity, which is also a reason why this disease can be difficult to manage and can influence a person's ability to take on daily tasks and activities. Additionally, symptoms appear at age 60, well usually, however, the number of people with this disease doubles as the age range goes from 65 and beyond to 85 and beyond. Alzheimer's disease is important to public health because it is one of the top leading causes of death in the United States, as it ranks high in the cause of death among US adults and adults aged 65 or more. This means that this disease is responsible for the majority of mortality cases in the aging population and poses a great concern to public health. The WHO recognizes Alzheimer's and dementia as a public health concern as they provided a plan for action. Additionally, it is a concern because being lost in familiar places or experiencing memory loss that inhibits the person from performing daily activities poses a great health risk. The costs of treating the disease are equally high, around 159 to 215 billion, which can be a burden in the US healthcare system. Now we're going to talk about the prevalence and rates. So Alzheimer's disease is considered to be one of the leading causes of dementia, and dementia is prevalent among about 24 million people in the world. However, this article that I was citing is published in 2012, and dementia prevalence is predicted to double every 20 years. The current prevalence of dementia is significantly higher because of that. So the World Health Organization states that currently there are more than 55 million people with dementia around the world, which is higher than double than what was predicted. It is important to note that Alzheimer's and dementia are not the same thing. However, Alzheimer's does contribute to 70% of dementia cases, which means that it does dominate in that area. Now, when examining the frequency and mortality of the disease, it is evident that North America and Western Europe have the highest rates compared to other parts of the world, and in terms of mortality rates, the CDC explains that Alzheimer's is the fifth leading cause of death among the people aged 65 or older in the US, and other factors that contribute to the increase in risk and prevalence rates of Alzheimer's disease include cardiovascular disease, smoking, hypertension, type 2 diabetes, obesity, genetics, and traumatic head injuries. Alzheimer's disease varies by age, sex, and race, of course. And when looking at this provided graph, you can see that the mortality rates that are shown significantly increase from age 65 to 85. However, when we see that the mortality rate at 65 to 74 is lower than mortality from 85 and over, it tells us that the prevalence of the disease does increase as age does go from 65 to 85, and the mortality rate increases similarly. So, as age increases past 65, the mortality rate also increases. Along with age, sex is another factor. Now, dementia and Alzheimer's impacts more women than men on a global scale. It is stated that dementia is about 60% higher in women than in men. However, the risk of dementia and Alzheimer's among adults with a history of traumatic brain injuries are higher in men compared to women. This is an area that men are higher than women in this case. Alzheimer's disease is notably higher in the US compared to other countries, and this could be due to the high prevalence of other health problems in the US, such as obesity, cardiovascular disease, which can increase the risk of developing Alzheimer's later on in life. The prevalence is higher among African Americans and Hispanics living in the US, as shown in the photograph that was taken from the CDC site right here, that African Americans 14%, Hispanics 12%, and non-Hispanics are 10%. However, when we do go out of the United States, these numbers are not the same thing. So it's only in the United States that these races are having a higher level of Alzheimer's disease than other races. Now, we discussed the epidemiological statistics for this disease. However, it is important to look into the possible solutions. Some factors that can decrease the risk of Alzheimer's disease are education, activities, Mediterranean diets, cognitive enhancement, increased physical activity, of course. If a person is overall physically and mentally healthy, and they do not have any other health issues such as obesity, diabetes, or cardiovascular disease, the risk of developing Alzheimer's is significantly lower. If the person already has the disease, it is equally important to stay active and participate in cognitive exercises to increase brain function. Staying active and living a healthy lifestyle is extremely important when dealing with Alzheimer's because it affects every area of a person's life. The more you train your body and mind, the better you will be able to cope with this disease. However, it is important to keep in mind that older people have a hard time staying active, and this is why it is up to the caregivers or family members to help the person live a healthier lifestyle. Now, to start off with the prevention strategies, it is important to examine the public health prevention strategies. So, according to the WHO, even though there is no known cure for treatment for this disease, there are different strategies that can help reduce the risk factors. The primary prevention strategy is aimed to prevent the disease from occurring. So, in this case, it is living a healthier lifestyle by increasing physical health, diet, cognition, and staying active. So if the primary prevention did not work out, we'd go on to the secondary prevention strategy. Early detection and diagnosis of this disease is essential to promote the most effective form of disease management. This is when the symptoms for early, middle, and late stages for Alzheimer's become important, and understanding these symptoms and knowing them are important as well. Because it gives opportunity for reducing unhealthy behaviors such as smoking or drinking. If the patient knows that they have Alzheimer's, they can start leading a healthier lifestyle by being active, controlling their weight and diet, and maintaining a proper blood pressure and blood sugar levels. These are some of these things that are mentioned here in these circles as well that you can see. Exercising, education, reducing obesity, stopping smoking. These things are very important in reducing risks for Alzheimer's. And lastly, the tertiary prevention strategy helps people who have already mild or severe forms of Alzheimer's, and in this case, the patient must have support from caregivers or family members to improve their quality of life, as well as practice cognitive and physical rehabilitation. And now the federal government is supporting public health professionals and people with Alzheimer's disease by implementing health programs. These programs offer public health awareness as well as services and optimized care for people with dementia and their families. According to the Alzheimer's.gov website, the government launched the National Plan to Address Alzheimer's Disease to prevent further expansion of the disease. And some other government-supported programs include Alzheimer's Disease Programs Initiative, National Alzheimer's and Dementia Resource Center, Healthy Brain Initiative, Alzheimer's and Related Dementia Public Health Centers of Excellence in Public Health Programs, and etc. As you can see here, these are the programs that are there to support the families and people who are dealing with Alzheimer's disease. And as conclusion, Alzheimer's disease affects many people around the world, and it is evident that some communities do have a higher risk when it comes to factors such as race, sex, and age. It is important to promote a healthy lifestyle, take advantage of government resources, utilizing the 3 important prevention strategies that we discussed, and increasing cognitive abilities to prevent certain risk factors from people who have dementia or Alzheimer's disease. And thank you so much for listening to me, and I hope you have learned something new today. These are my references. Thank you so much.